Prabhu, 75 years old. I met with an accident on the way from my clinic to my patient's house for a visit at around 1 o'clock on 5th of June 2024, and unfortunately while walking towards my vehicle, I was knocked down by a running cow from behind, and suddenly I fell on the right side. Somehow I could manage to get up, but that time I found my shoulder is drooped down, and I could sense the dislocation of right shoulder. But still carrying my visit bag, I went to the cab and went to visit. There I took ice fermentation along with one paracetamol, and I called Dr. Chintan Desai for the help. Meanwhile, I reached to Dislocation Hospital for getting my X-ray done, and then that same hospital, Chintan Desai, around evening 7 o'clock, under GS, reduced my completely arm, and I was in shoulder bag and discharged next day morning. The movement was not there. I was not supposed to move the hand, and I was resting home for 1 week. I consulted Dr. Chintan Desai, who told me about the ligament and damage to the capsule and all this thing. He explained me the arthroscopic surgery is a must, and there is no scope for only physiotherapy. So I agreed with, and again got admitted after 10 days to same Dislocation Hospital for arthroscopy surgery. This is the first time in my life after 51 years of my practice, and although I was working resident of Dislocation Hospital, I landed first time in OT for surgery arthroscopic. The surgery went well. One day it was little painful as a doctor and a patient to bear but it was not much discomfort. Then the shoulder bag was given to me with a pillow. That was the most discomfort during earlier 3 weeks. My hand was tied to the shoulder bag, but somehow I managed after 2-3 weeks and attended my clinic as well as my corporation office. That time the pain was not there, and the hand movement I used to take at home passive physiotherapy with the assistant of physiotherapist from Gokuldam Medical Center. And afterwards I showed to Dr. Chintan Desai for follow-up after 2 months, and that time sonography was done, and I was examined for the power and movement and all this thing. Movement was physiotherapy for now 3 months. I come for a follow-up. The pain is almost minimum, and the mobility is around 70 to 80%. That means I have recovered partially, but not completely as I expected. But now Dr. Chintan Desai told me some tips on physiotherapy. If I do that, I hope to recover almost 100%.